Turning our attention now to the ASX, here's Matt Birney and Bulls and Bears with the latest public company views and interviews.
Welcome to Bulls and Bears, brought to you today by Proteomics, ASX code PIQ. I'm Matt Birney and I'm joined now by the Managing Director of Proteomics, Dr. Richard Lipscombe. Hi, Richard.
Morning, Matt.
Proteomics is a biotech company that has developed a fascinating predictive blood test known as ProMarker D. ProMarker D is able to predict the onset of diabetic kidney disease years in advance of an individual actually suffering from it. The company is also looking to extend its predictive disease testing platform to other diseases and recently tabled the results of a positive clinical study that appears to support its use. Richard, before we get into the results of that study, exactly what problem are you trying to solve with ProMarker D?
The problem is there are over 460 million people worldwide with diabetes today, and 1 in 3 of those has already developed diabetic kidney disease.
And is there a test for it now?
Current tests simply aren't good enough. They're only able to detect disease once it's started. We've been able to do is develop a new kind of test that can predict the onset of disease long before clinical symptoms appear.
I know you're involved in a clinical study recently. Tell me about that clinical study.
We've been working with a large pharmaceutical company from the US called Janssen. They have a new drug called canagliflozin for the treatment of diabetic kidney disease. We looked at the patients who went into the start of this study. We measured their scores again at the end of the study after 3 years, and we saw a dramatic improvement in those patients who were on the drug in terms of reducing their ProMarker D risk profile.
And so the upshot of all that, if I'm reading you right, is that you potentially could have predicted that those people would have developed diabetic kidney disease at the start of the trial. Is that right?
Absolutely. So we predicted which patients were at risk of developing disease. Those on the drug, by the end of it, they had a decreased risk of increasing kidney disease.
What other validation do you have that your technology can predict kidney disease before it happens?
We followed over 5,000 patients in long-term clinical studies. So we've been able to show which patients would develop chronic kidney disease after 4 years.
And what sort of success rate?
9 times out of 10, we could predict which patients would develop disease after 4 years.
What's the commercial model? How do you make money out of this thing?
We put the test into pathology labs around the world. The test is starting to roll out in Europe at the moment. It's about getting the test into the labs, into the hands of treating doctors, and then Proteomics International will get a royalty on every test sold.
Can you apply this technology to other diseases? Can you predict other diseases potentially from it?
It is groundbreaking technology. We're looking at a range of other diseases, endometriosis, lung disease, other complications of diabetes. All of those are potential targets where we can develop a new test, and we look forward to bringing those to market in the years ahead.
Dr. Richard Lipscombe from Proteomics, thanks for joining me on Bulls and Bears today. And remember, we're only here to give you information, not advice, which you should of course seek independently. I'm Matt Birney, and this is Bulls and Bears.
For more public company CEO interviews, go to the Money page at 6pr.com.au and click the Public Companies tab.